Hello, everybody. Today is World AIDS Day. It's an important day because HIV/AIDS has been a pandemic that has ravaged the world since the 1980s. There's been a lot of medical advancements done in the HIV/AIDS program to the point where people who have HIV can live functioning, healthy lives if they have antiretroviral drugs available to them. To that effect, in the United States, HIV/AIDS drugs are disseminated by the Public Health Department and therefore can be made available free in the United States. We don't know what the policy of Bobby Jr. is going to be with that. We know there's going to be a lot of public health cuts coming into the picture in the next year or so. We don't know whether funding for HIV prevention, thereby HIV testing and HIV medication, is made available to all public health departments in the United States. The second is that the United States helped with AIDS prevention, treatment, and education all around the world through the PEPFAR program. That was part of the USAID initiative, that was a global initiative that provided food as well as health assistance to areas of the world that were poor and that needed HIV medication. There have been reports that hundreds of thousands of people have died because of the unavailability of the HIV vaccine, not vaccine, of the HIV treatment in the African continent, and that experts project that lack of HIV drugs provided by the USAID program and the United States, lack of those drugs will account for thousands and thousands and hundreds of thousands of deaths, preventable deaths all around the world. And that will impact the United States, not just in the soft power, not just in really sowing sort of bad seed, a bad ill feeling about the United States in these other countries that are being deprived of this basic assistance that they need to get by. It also creates the possibility of HIV/AIDS spreading into the United States, because it will spread around the world if it is not managed in the hotbeds in sub-Saharan Africa and parts of Asia. And remember, the HIV pandemic is an ongoing pandemic. Millions of people live with HIV every single day, and many of them, most of them, live healthy, productive lives if they have access to HIV treatment, which is a lifelong treatment that you have to take. And that is provided by the US government so as to not create an outbreak of HIV. So if these global programs are stopped and international people are allowed to come into the United States, which Donald Trump is trying to stop, what that will create, because you can't really stop people from moving around globally, even if you put in the toughest immigration policies, people will still slip through, and that creates a possibility of the virus getting through and getting out of control, even in the United States. And then there's, as I said, the topic of HHS under Bobby Jr. taking away public health funding for preventive infectious diseases. That came out in the news some months ago, and I don't know where HHS and CDC is on that, because it must be made certain that HIV prevention drugs be available to Americans without cost, because the risk of not allowing that to happen is an outbreak of the HIV/AIDS pandemic, where millions and millions of people will be affected, and it will create chaos across the country and across the world. With that note of warning, I hope that we all keep in mind people living with HIV and understand that it takes collective compassion for people to live their lives. And the collective compassion manifests as programs like USAID, 87% of which was cut. Hopefully the 13% that Marco Rubio said is not cut will include the HIV medication, which has been frozen so far. So people are dying because of the lack of this medication that USAID programs provided around the world. With that said, thank you for listening. Please take care of one another. Like, share, and subscribe this message, and share this message. It's important that we not hide what is the truth of HIV/AIDS being an ongoing pandemic around the world to this day, over 50 years after, or nearly 50 years after it first broke out around the world and caused mayhem. Take care.